We'll begin then. Thank you. So, welcome to the meeting of the Health and Wellbeing Board. And have we got any apologies?
Yes, Matt Pope, Alice Kunjapi Clifton, and Nick Fellows.
Thank you very much. The minutes of the previous meeting, do we all approve those? Was there any problems with them? I don't think so. Probably wearing two pairs of glasses is I can't see the screen if I've got my reading glasses on. Okay, thank you. Declaration of interest. Has anyone got anything to declare this agenda? Don't think so. There's no public or member questions. So you look at the Wellbeing Board annual report. You don't. Look at prevention and youth justice, sorry, which is Adam Davis. Is he here? Adam isn't here yet.
No, good evening, Chair. Adam is attending a prior meeting, but we have Bayer Nagolin, who's the service manager for the Youth Justice Service, who's going to present.
Thank you, Emma. Is she?
Can't see that she's joined yet.
Okay, we'll go on to the next one and then. Oh, Jonathan's not here either. So,
If you go on to the ICB update and go back again.
ICB update. Sorry,
So it goes to ICB update.
Yes, because people aren't here. I'm sorry.
Okay, that's fine.
Sorry, Matthew.
My
Get you in quickly.
My PC hasn't powered up yet, so I'll try and do my best to remember. But that's fine. So from an ICB perspective, a few things going on. Obviously, the operating model update. We're now into implementation of that, which is, I think, great for our staff given the uncertainty over the last. And particularly important actually for us to move to some recruitment, given we have over 200 vacancies across the ICB. So really pleased to land that. In terms of the links with place partnerships, which obviously was an important aspect of the feedback, we've made some amendments to reflect some of those concerns and articulated the importance of place in the operating model, including putting an exec sponsor in place for each of our places. And when I refer to place, I think you know that I refer to the free places, but actually appreciate that in Berkshire West, it's important that we recognise the free local authorities. So I'll try and get that terminology correct. But we are looking to put an exec sponsor in, hopefully confirm that over the next few weeks in terms of that link. And in the meantime, we will carry on as is, which is executives linking in. So I link in with the unified exec, which is linking with NHS leaders and local authority leaders on a regular basis. And executives come to each of the health and wellbeing boards across the patch. So it's my second one of Wokingham today. So that's an important aspect. In terms of key posts, we have just offered I can't name the name yet, but a chief medical officer replacing Rachel Decoe. She goes off, and we're interviewing for a chief people officer as well. So that will give us a full complement of executives, including a substantive chief exec and a substantive chair, which will be the first time in ICB's existence that we have that full exec team and chair and chief exec. We've obviously been preparing for winter, lots of work going on to preparing for winter across the patch, working with our trusts and partners around that. And I think we've included in the report some of the good work that's been done across all of our places around hospital at home services and an important evaluation around that. What wasn't in the paper, it was the national change programme that I wanted to highlight. So you'll be aware that DHSC and NHS England are working together on a 10-year plan that has now gone to a consultation phase where nationally we're inviting feedback and ideas in terms of how we address some of the challenges facing us over the next 10 years. That was launched on the 21st of October and runs to the end of December. So I know that Helen sent through a revised paper with the appropriate link on, so hopefully we can work out how to get that distributed. But I'm sure it's come through multiple communication channels anyway, but I wanted to ensure that we identified that as well. So I hope, without having it in front of me, I've covered the main aspects of the update. So apologies, my PC is just getting warm now. But if there is anything else in the briefing that you wanted me to expand on or general questions, then I'm happy to do so. I would say I've been involved in a number of discussions across the Berkshire West patch over the last days and weeks, and we've got the SEND inclusion strategy on the agenda. So I know I've had lots of debates with Emma and others around some of the challenges there. And I think we probably had some good debates, some challenging debates, but some good debates in terms of some of the changes that we're looking to make in that space. But happy to take questions.
Okay. You got questions? Oh, sorry, Susan.
So, Matthew, thanks for that. I just wanted to ask about the exec sponsor, because as always, just want to be reassured that Wokingham has the time that it needs in terms of dedication of time. Because of course, when we had a director that was in the old structure that was responsible for the 3 areas, they could give time, notwithstanding the complexity, to the 3 different local authority areas. And I'm just looking for the assurance that there is the time in the new structure, including that from the executive sponsor.
Yeah, and I think it's a good question. And I think if I have to be completely honest, I think the Berkshire West model will have to be slightly different, because I think whilst an exec sponsor, I think, can do some of the overarching linking, working with Helen and the team, working with the unified executive, and that forms. I personally think we're going to have to strengthen that by putting in probably a 2 or 3 exec sponsor model into health and wellbeing boards. So I expect we will have to not completely double that, but I think we'll have to have a link into health and wellbeing boards, as well as an overarching coordinating role within Berkshire West, because otherwise I don't think we'll be able to do justice to the stakeholder engagement aspects of this patch. So we will, and I've spoken to Nick about that, we will need to adjust our model slightly to make sure that we've got the right level of consistent presence for the 3 local authorities in the Berkshire West area.
Because it's garnering that knowledge, isn't it, about the locality and the differences and the need in the different locality. And
there is a need for a consistency, I think, of attendance to that, because you grow relationships and you grow knowledge. So I think we will have to amend the model slightly, I think, to make sure that we do support the 3 patches.
Okay, thank you.
And thank you for being honest, Matthew, because saying you've got to amend things quite soon is positive, because I think you're seeing that there's a problem and you need to answer it, and that's very, very heartening.
Thank you. There's 2 things I wanted to ask about. One is the winter vaccinations, and congratulations on having a very good vaccination rate across the southeast. But can we have a breakdown of how we're doing in Wokingham? I don't expect you to provide it now, but
Good.
so that it will be handy to know how we're doing locally. The other thing is the hospital at home. Again, really good thing. I remember this being one of the first projects that was discussed when we brought in the Better Care Fund. So it's got a long history, going back quite a long time. So there's 500 adult beds and 12 paediatric beds. And I'd like to know how many of the adult beds are in Wokingham, but also where the paediatric beds are, because there's very few of them, and I'd like to know where the nearest ones to us are. That's really it. Again, don't expect you to answer that now.
Yeah,
if we could have that for the minutes, that would be great. Thank you.
Absolutely. And when I read our briefing before coming, I knew that would be that would be the question. And you may know the answer to that. I'm not as well cited, but we will take that away and circulate that around.
Sorry, was the question where are the virtual paediatric beds?
I expect covering what geography was the question, I'm assuming. Was it because I think obviously a hospital home, we've expanded to paediatrics in certain areas. I don't think it's fully consistent across Bob, so that's what I'd need to check. You may know what the model is in Berkshire, West Andy. I'd have
I don't, so no. We'll take that together.
Yeah.
Andrew.
Yeah, Matthew, I wondered whether actually you wanted to just give a little bit of flavour about the work that's ongoing, that I know some colleagues will be aware of, about the update to the joint forward plan, because particularly I think that does give a Wokingham, that will result in some kind of Wokingham flavour about how things are going, which I know is where Prue was really keen to touch on latest, and when this board might get some output of that.
Yep, happy to. So we are trying to, but obviously we need to refresh the joint forward plan. You'll be aware of some of the financial challenges facing all public sector partners, and we're part of that across the ICB and indeed the ICS partners struggling financially as well. So we are doing a bit of a reset to the joint forward plan. We've just commenced some analytical work to start to inform that, and that will segment the population by local authority area in terms of some of the future disease prevalence models, some of the resource utilizations areas, and Andy and I started to see the very first output of that at a session yesterday, and it is really granular in terms of some of that localization agenda. So absolutely, once that work's finished, you'll start to see some of the feed into a local authority area, and we can work that through. I think in terms of process and progress, we're looking to see the output of the analytics over probably before the end of December. So I would imagine that we could bring something to the next Health and Wellbeing Board. I think I saw that was in early January, if I remember rightly. Slightly cautious about what level that would be at that time, but I'm certainly happy to commit to an update in terms of where we are in the process of refreshing the plan, and to demonstrate that we have got that local insight and knowledge in terms of moving things forward.
Stephen.
Thank you. Thank you for taking the item slightly earlier than you thought you were going to have to. Can I just ask a question related to the GP collective action section of the report? I don't know whether we've got anything in the pipeline about the potential or highly likely involvement of pharmacies in some form of collective action. Is that something that you're planning for?
I think we're broadly aware of the risk. I think it's probably how I would describe it at the moment. And with these elements of industrial action, it's at times it's difficult to assess the level of risk at the collective action. Obviously, the slightly different model to the industrial action we saw from doctors earlier on in terms of impact, and the collective action issues around GPs are still growing in terms of an understanding of the potential risk and impact as that continues. And so we need to understand the nature of the risk across all areas. And I have to say, as in terms of some of the risk going into next year, we also know that there's going to be some particular aspects around changes to NI contributions for all those sectors of the NHS, as well as actually, well, not to extend the debate, but actually across the voluntary sector as well. There's going to be a number of issues in terms of risk and pressures around that. So it's a watching brief at the moment.
Yeah, we're only too familiar with that challenge. Yes, thank you.
I was going to ask, I mean, your remodeling of the workforce model was partly to save money. Is this going to happen? And, you know, what is your projected savings and so on in that?
What aspect of, sorry, what aspect of the workforce? Oh, the ICB?
The ICB.
Oh, right, okay. Sorry, I thought we were talking about the wider issues around workforce. So no, what the operating model has had to do from a financial perspective is address a 30% reduction in running costs, and absolutely that has been addressed in the new model. And as I said, with the number of vacancies we're presently running, we'll probably do even better than that until we recruit some of those vacancies. So. But it is a completely separate allocation for the ICB, actually the running cost allocation, so it's quite separate to core programme costs. But yes, we're confident we will be able to achieve that as a result of the changes. But actually, I think it's important to say that a lot of the change to the operating model were not absolutely driven by a cost reduction. It was driven by a need to reframe and strengthen some elements of the ICB as well in terms of that ability to resource allocate at a strategic level.
But obviously, with a 30% reduction in the workforce with the ICB workforce, you would think there will be a reduction in the efficiency of that. Will that be noticeable, or do you think that won't be too noticeable?
Yeah, I think it's an interesting question, because I think part of the development of the integrated care board and how we operate as a commissioner, I think, is almost allowing our partners to step into some of that space actually and not duplicate so much. And so, but the work the provider collaborative is doing, for example, across the 3 acute trusts, that's doing work that perhaps ICB staff may have been doing previously, and indeed we're transferring some staff across the acute provider collaborative in terms of some of the work the place-based partnership is doing together. Again, some of that is stepping into space that perhaps in clinical commissioning groups, they may have stepped in and done some of that work. So I think if we get it right and we manage to empower our places and our collaboratives, I think that's the way we would manage that reduction. But it will have its challenges.
Thank you. I can't see any more questions. Oh.
Sorry, in terms of the statement, the recent autumn statement and the increased funding for the NHS, what's your view on the impact that might have on Bob?
If I'm being completely honest, I think we're expecting a real terms cut in NHS funding going into the next 3 years. That's my assessment of the autumn statement and its consequences. And that's clearly the message from the NHS leadership as well. Mm-hmm. So I think we are going into a tough 2 to 3 year period and expecting real term cuts driven broadly because any growth will be diverted to pay increases.
Right, that was going to be my question as to where you see the growth actually landing.
So that's our broad planning assumptions, and we are preparing for real term cuts over the next 2 to 3 years.
Okay, so you, just so I'm understanding, you think that the can't remember the exact number in terms of billions, but will be spent mainly in terms of
yes, you've got in terms of pay awards, and then you've got the NI contributions. Yeah. And also from a Bob perspective, we've also got a 60 million deficit to repay as a system next year as well. So yes, it will be a tough for all public sector bodies, mm-hmm. But that's our planning position at the moment.
Okay, thanks. Thank you.
Okay, thank you. Would you like to do yours now, Andrew, as you kind of follow on, or shall we go back to the beginning?
I'm happy to do that, Chair. So I think Matthew's laid, in his answer to the previous question, laid some of the context, and in keeping with my previous updates, we are. The teams across the organisation are working really, really hard and focusing on the key operational standards. We again, we're not where we would aspire to be, but relatively we feel we're doing a good job, and teams are working really hard on that. I think the main challenge for us is on the financial side. We have a huge efficiency target to deliver this year. We're behind plan on doing that, and looking forward, as Matthew's already alluded to, the financial settlements are really challenging for the NHS as a whole, and if we are serious about engaging in the 3 shifts, we will need to work with partners about how demand reduces if we're to take cost out, or even if we're to keep cost as is, such that any funds that are about growth are rightly diverted towards community, digital, and prevention. The look at our financial data suggests the vast challenge of that efficiency and deficit position is driven by demand, and more demand than we were expecting, and more demand than we've experienced. So we need to understand what can be done to support people with their care needs in different places. So that's the forward-looking challenge. I don't have too much to say about the new hospital. The review is still ongoing, so there's not a lot more to update about that position.
Thank you. Has anyone got any questions?
Thanks. That was helpful. Do you think then, based on what you've just said in terms of that focus on community, digital, and prevention, there'll be some more investment into some of the things that local authorities provide in the community? Do you think? Because that is about stopping people from actually going into hospital.
So I think that's more of a question for Matthew.
Okay. Sorry.
But that would be the logical conclusion. If you're serious about this, then any money that you've got has got to look into those spaces. But it also means that in order to hold the spend and resist the spend to put money into the hospital sector, we've also got to look at, are we getting the most value out of what we're already putting into the community? So it's a kind of twin question, and it's actually one of the questions we had together when we were looking at this really emerging data, is if we're showing a gap relative to the national standard here, is the cause of that gap because we're not putting enough money in, or is it that we're not getting enough out of the resources that we're already putting in? And because the two lead us to very different kind of asks of teams. So that's why the work's really important.
Okay, so the data, that piece of work then is important in terms of the value that.
Indeed, yeah, and I think what we can already see, and we're going to see when we say that, we know we're going to see lots of variation. And to Andy's point, what is driving that variation? Is it local population need? Is it the effectiveness and efficiency of service delivery at a local level, or is it the amount of transformation that's been done in particular service lines? So we need to challenge ourselves on all of that. And if we're going to get through the next few years, we've got to try and get that balance between needing to do that left shift and taking some investment risk around that, but also transferring some services to be more focused out to the community and on the prevention agenda. But we know that's tough. We know how tough that's been over the last couple of years to start to make progress on that. And I know that some of the good work that's been done locally across this patch around, with that relatively small amount of health inequalities money, to try and start some progress on that. So we're going to protect that funding, but actually that's probably the tip of the iceberg, and we need strategically to work out how we can shift some resource and invest. But it's going to be a challenging debate, and I expect, as often is the case in the NHS, there will be elements of ring fence money to drive particular initiatives that are seen as good practice, despite the overarching challenge of financial environment. That's the way I think that often the NHS tries to drive some innovation. So I expect that will continue, and hopefully that will enable us to target some resource.
Thank you very much. Are there any other questions? I don't see any. So can we go back to Prevention and Youth Justice Service?
Yes, thank you.
Hello.
We have Bear here.
Sorry.
So my name is Ben Nigoli and I am the team manager for the Prevention and Youth Justice Service. And today I'm going to present you with our annual plan, which has already been submitted to the Youth Justice Board in June 2024. And we are now presenting to this board to be accepted. The timing of the submission to the Youth Justice Board is always in June of each year. So it's practically impossible to bring the plan prior to this board because of the dates of the different boards. So that's why we're bringing it today. This plan is an update of the work that we have completed the previous year and lays the foundation of the work that we're doing, in this case, during this year, 2024-25. I'm only going to do a whistle-stop tour of the plan because I am aware that it has been circulated in full to everyone in advance. So if there's anything else that, other than the highlights that you want me to talk about, please feel free to ask me questions. I would say that regarding last year, if the board members today have to leave with one achievement, thinking about one achievement of our service, I would say that's the reduction in the number of first-time entrants into the criminal justice system. So last year, Wokingham had the most significant drop in first-time entrants of all South East and the Thames Valley region. That was a 55% drop. This is the number of children that get into the criminal justice system for the first time. How did we achieve that? Or how can we explain that achievement? And we cannot think about that achievement without thinking about the prevention work that we're doing. And that's one of the highlights and one of the areas that we are focusing again this year, working on prevention so that we reach out to children early. So last year, we were working on the rollout of the exclusion prevention program to the whole of the borough. We continue with that this year, and we're also focusing on new ways of prevention so that we work with children earlier and before they are in touch with the criminal justice system. This is not something that's statutory or mandated by government. This is an approach that the service has, and that is completely aligned with the Help Early approach that the Directorate has in that respect. There are other things that you will have noted in the report, but because of this board, I want to focus on partnerships. Partnership is actually one of the focuses of our plan. And in the recent inspection that we had from the government in June 2024, actually the health partnership has been commended amongst others. It was health and education, in fact. What we are doing as a service in terms of health and with the partnership with the health justice team, which is CAMS, speech and language therapy, and the physical nurse, is in particular we have committed to a 1 year additional funding for more time from the speech and language therapist worker for our children. This means that more children will be able to have access to this resource to be assessed and have some time with the speech and language worker, which will address and support any communication needs that the children may have. And a vital piece of work that this extra time has allowed us is for the speech and language therapists to produce communication passports for children who are attending court, so that the traumatic experience is for the children less traumatic because they are able to communicate better or with the court, or better say, for the court to communicate better with children. You were recently talking about vaccines. We have a physical nurse and we are launching a flu vaccination clinic in our service. It's going to be next week, and that is going to reach out to children that usually from the most deprived backgrounds and are for a number of reasons not able to access the vaccine through the regular pathways. And within the limited resources and actually constrained resources and commissioning levels that we have for the health justice team, we're trying to make the most out of that partnership so that we can improve the services for our children. Also, in terms of partnership and health, in some respects, we have developed a new partnership with the educational psychologist team so that they are helping our practitioners to better help the children we're working with. And finally, I would say that it's not necessarily partnership, but a big piece of work that we are focusing on this year is around children and hearing or listening to the voice of children. We continue to work on the Children Speak Freely panel, which is a forum that we have started to be able to listen to the voice of children so that they can truly and really help us shape and inform the service that we deliver. Try to keep it short and sweet.
Thank you very much indeed. But Prue.
Thank you, David. This is a really good report. It's a good service, and I think we kind of skated over the fact that they were inspected in the summer. Previous inspection, which was in February 2020, they were requires improvement. This time they're good, and I brought with me because I'm so pleased with it. A quote that the Chief Inspector of Probation made, but I would say we weren't just good, there were quite a lot of elements that were outstanding, and one of those elements was the staff. So I think thank you to you and your team, because you've done a cracking job. But I just wanted to quote what the Chief Inspector of Probation said, which was, "The staff are motivated and enthusiastic," I think we've heard that, "and are supported by a knowledgeable team manager," well done, "who has been critical in driving these improvements forward." So I think we should acknowledge that they are a great team. They're doing a very good job, and we're very grateful to them because they're clearly having an impact on offending in our area, and that's a really good thing.
Yes, I mean, I think we all want to say thank you very much for all you've done and your team, and it's great that, you know, because it's important that if you catch people young and distract them and give them other things to do, they won't go into the criminal justice system, and that's better in the long run as well, because, you know, if someone's in it at 18, 19, they'll probably be in it for life. So it's great that you're doing that and keeping people out of that system. So thank you very much indeed. Good.
Yeah, I really wanted to second that point, actually. Sorry, Stephen, did I come in before you? Sorry. That point about that reduction in first-time entrants into the criminal justice system, so impressive, because that really makes a difference to young people's lives and their future. So yeah, I thought that was really fantastic, and it's really good to hear about the partnership, the health partnership as well, that was commended, and particularly with our health colleagues here being here today. So that's really great to hear, and I want to say really huge well done to the team as well. So thank you.
I'm too late to second the facts, but I'll third them if you could do such a thing. Both to all the officers involved for their incredibly good and hard work, which has really transformed a service area. So you really can be immensely proud of what you've achieved there. But I also wanted to highlight two themes really that, again, Susan has touched on. One and David on the other. The first is partnership and how important partnership working is. That's a kind of theme that has wider resonance across the council in a way in which we're trying to address the challenges we face as an organisation. Partnership working is absolutely central to that, and we will do all we can to always encourage partnership working. But the second point also has much wider applicability, and that's the importance of early intervention and prevention. We talk about this in the context of the areas of responsibility and interest of this board, but it has a much wider application, I think. Prevention and early intervention can save, ultimately, in this case, lives from being ruined, but also can save a great deal of public money in the long run. So these are really good and important things you're doing. So thank you.
Any other questions? I don't think so, but please do take our thanks back to your team and tell them that, you know, everyone is very, very impressed with how you're getting on and all you've done and how you've changed the area so much in the last 3 or 4 years. So thank you very much indeed for all you do and all your team does. Sorry, we've got to vote to accept this. So can I propose for a seconder? And all those in favour? I think that's accepted. Thank you very much indeed. Okay. So, Jonathan, the all-age autism strategy and the SEND inclusion strategy.
So Jonathan's here to present, Chair, in relation to those 2 strategies.
Thank you.
Evening, everyone. Nice to be here and pleased to be able to present these 2 strategies that have taken quite some time to culminate in approval here. These are both all area strategies, so they're not council strategies. These are system strategies that sit across the work we do as a council, but also health colleagues, schools, parents and families, and our voluntary sector all working together. As you know, these are the themes of the evening. It feels like I think I'm hitting the same notes as previous speakers. I think collaboration for both strategies is absolutely crucial in terms of getting them to where they are now, having built that consensus around what we should be doing together as a system to more effectively meet needs. Co-production is a sort of theme within the world of SEND, but co-production has been evident throughout the production of these documents. I think we've had a lot of involvement from parents and carers in the SEND strategy, and from service users and young people, and people of all ages in the autism strategy, and that theme has continued throughout and continues now also into kind of delivery planning for implementing some of the contents of these strategies. So partnership and togetherness is probably one of the key themes I'd want to pick out. The other one, again, repeating what's been said previously, is around prevention. I think prevention is one of the key principles and key strategic priorities, prevention and early intervention in both strategies. You know, we're all aware, I think people will be aware, I think SEND hasn't been out of the news in the recent weeks. It's the special education needs and disabilities system nationally is under great stress. There's huge pressure on the system across the country. Wokingham is no different. We are under massive acute financial pressure across the SEND system, and the only way we're going to really get ahead of that and really turn that corner is by focusing our efforts on better early intervention and prevention, helping families earlier, getting alongside them earlier, and helping them address some of those difficulties. What we're seeing evidence of over and over again in the system is children who, had we got alongside them a little earlier, probably wouldn't have had their needs escalate to the point they have, but we're playing catch up because some of those services haven't been quite where they needed to be in recent years, and we are now, as is the case, I'd say nationally, wrestling with a kind of wave of demand and wave of need, particularly driven by the pandemic, particularly sort of acute following the pandemic. I think there's been escalation of rates of education, health and care plans locally and nationally that have really escalated since the pandemic, and we really are facing this kind of wave of pressure. To some extent, you could say threatening to overwhelm the system, but we're doing really, really positive, good work at the moment to really get things in place, get that preventative approaches in place, and work with, particularly with our school partners, as well as in the early years, and particularly with colleagues in health, to really begin to turn that corner and get some of that support in place a little earlier. The other major pillar, I'd say, in terms of what the pillars of the strategies, if you like, are around provision, because it's not purely about early intervention prevention. Some of our children clearly have needs that will be evident throughout their lives. They have complex disabilities and difficulties, and we haven't had the right mix of educational provision in place to address those needs. So we don't have enough special school places, we don't have enough specialist provision, and we are going at a great pace to develop that provision that's needed. But in the process of doing that, and that takes some years to develop in terms of new schools that are coming, that's, you know, whilst those are developing, we're still facing that pressure on the system. But we've got a very clear idea of what the area's needs are now, and a very clear idea of what kind of provision we need to develop and that's happening at pace now. But whilst we're turning that corner, turning that curve and turning that corner will take a number of years. So we've got a difficult few years ahead of us. We know that as a system, and the schools are well aware of that. And I think we've got good support and good understanding with our colleagues in schools and colleagues in other services. So the strategy really paints the picture of what needs to happen over the next 5 years. These are going to be a challenging 5 years. As I heard colleagues from health saying earlier, the same pressures are facing the health system. But we know we're going into a challenging period. But what the strategy set out is how we're going about prioritising the areas of effort and work and investment that need to happen between now and 2030 to really begin to sort of turn that curve and get the system as we want it to be. I think we've got, you know, it's taken quite some time to develop and culminate and finalise the strategy, probably longer than we expected. But that's because it's taken the time to build the partnerships and build those relationships and build that consensus. And I really think it's been time well spent, because we really do have a kind of fairly shared vision about where we need to go to next and how we're going to get there really over the coming years. I wasn't planning tonight to dive into the detail in terms of what's in the two strategies. I think those themes are probably the kind of right summarised really, you know, the direction of travel and how these strategies have come to formation as they are now, as they're presented. But I'm happy to take any questions about more detailed points if anyone has any questions. But otherwise, I think that feels like the right level of detail for this context.
Thank you, Jonathan. Who's got a question?
I haven't got a question exactly. I wanted to talk a little bit more about both the local and the national context for the SEND strategy. So the first thing is, it's called a SEND and inclusion strategy, not a SEND strategy. And it is all about inclusion. In fact, we had an education partnership conference on Monday, our first one, I think, ever, which was all about inclusion. Our schools are on board with it. And it's, I think health are on board with it. I'm not going to say that you are. You've co-produced this strategy with us, and it requires all of us as partners to participate, because SEND is not a local council thing. It's an area thing. So we're all responsible for it together. And that prevention, early intervention strand, we're beginning to move on it to make that, you know, to put those interventions in place. It's taking quite a long time to get the tanker to turn around, and I'm not sure that we could do it by ourselves locally, even with all of us participating and knowing what we're trying to do. And this strategy is our shot at doing the right things in the right order with the right local provision. We are already focused, and I know the government has talked about this in recent weeks, on inclusion in mainstream. That's something that we're already looking at. We've got quite a good record on, and we're working quite hard on it. We do need some specialist provision. We don't have enough local specialist provision, and the alternative for us is not, should we have mainstream exclusion or specialist provision? We're already doing the mainstream exclusion, but there will always be children who need specialist education. And our choice is it state funded at 20-something thousand pounds a year, or is it in independent special schools at 60-something thousand pounds a year? And you can see where the public purse might benefit from having more local provision. We've got some local resource units and SEND units coming with our schools, our mainstream schools. But we do need the two SEND schools that we have won in a bidding process, which now unfortunately seem to be stuck, delayed from their original start date. We still don't know exactly when they're going to be delivered, but that's a problem which we are bringing whatever resources we can to bear on it, including our local MPs, to try and get an answer on that. But if I could move from the local to the national picture, whatever we do locally is not going to be enough to solve the problem that we've got, because the funding is structurally insufficient. It just doesn't work. And the National Audit Office report, which came out a couple of weeks ago, actually says that the SEN system is financially unsustainable. So we can do our best with it here, but we need a fundamental shift nationally. If we don't get it, then if the ministerial override that currently prevents the deficit in the high needs block, which is part of the schools grant, that prevents it coming onto the council's books at the moment, if that disappears in 2026, which it's currently timetabled to do, councils will fall over up and down the country. The first estimate a few weeks ago in the County Council Network survey was that a quarter of councils would fall over immediately, and then another quarter within 3 years. And it really is quite stark. I can't see the government letting that happen, because that would be foolhardy, really, to have that many councils that do adults, children, social care fall over altogether. So I cannot bring myself to believe that they will abolish the ministerial override at that point, or if they do, they will have done something to do something about the funding beforehand. But if all they do is wipe out the existing deficit, it's not going to solve anything. It needs to be a new arrangement for SEND funding, and it needs to acknowledge that health also needs funding to provide the therapies that we need to provide. We've got gigantic autism and ADHD waiting lists, all those kind of things, and mental health problems that we've got, children with physical disabilities, all sorts of things. So this is a system thing, and again, the theme of the evening seems to be the partnership working. It is really critical for everybody that this gets sorted out nationally. But I think locally we've got a good strategy, and if all the partners work on it in the way that it's envisaged, it will stand us in good stead, but it won't solve problems for us completely at all. And I think we need to just acknowledge that. I don't know whether Emma has anything she wants to say about it, but I don't want to be too apocalyptic. I mean, I think the one thing I think we do need to acknowledge is that although we are certainly not a perfect service, and there are issues with our communication with parents and things like that, the outcomes for our children with special educational needs are well above the national average. So we are doing something right, even if we don't get everything right.
Thank you, Prue.
Just a kind of really interesting overview. So I read I think the strategy is good. I read the National Audit Office. That was difficult and challenging reading. And also, I guess, to Susan's point earlier, the autumn statement, I think we're still trying to get our head around what that means in terms of the prioritisation of spend, and that might be that I'm not familiar with the nuance of council grants and allocations, but I think we're still trying to understand what that might mean. But I take the point, I think that there has to be a joined up approach across councils and health in terms of addressing some of these fundamental embedded weights that really are challenging. But good strategy. The implementation is the challenge.
Thank you. First of all, thank you to John and all of his colleagues, both inside and outside the council, for the work they've been doing on these strategies. And as Prue said, and I'm going to be in some senses amplifying points Prue's made, locally we are working very hard to try and address the problem as much as we can. But we all know that this is, as your report and presentation illustrated very well, a national problem, not just a local one. And really, I'm not quite so worried as Prue about the statutory override. I'm quite sure that's not going to go. But it, as you rightly said, doesn't really address the problem, because the problem remains hanging over us. And simply wiping off the deficit isn't enough either, because it'll soon build back up again. So what we need is a reform of the funding formula that recognises the true costs of delivering adults and children's social care. And without that, it's going to be very difficult. It's going to be very difficult for a lot of councils. we are probably in we are definitely in a worse state than many councils. 151 councils in England that are charged with delivering adults and children's social care. And in terms of core revenue funding from government, we're 151st. We're not just 151st. The 150th receives nearly twice as much as we do. So these are really quite serious problems for us to contend with. And the work we're doing locally is brilliant, and I commend it, and I'm delighted with all of the progress that's been made, and I want to express my gratitude for that. But we are up against it so long as the national situation remains so unfavourable, and we will be using all the means available to us to lobby for an adjustment of the funding formula that takes account of the true costs of delivering adults and children's services. The all-age autism strategy clearly, as the name suggests, is not confined to children's services. It's looking across the piece. So it's important, I think, we do lobby, conscript our MPs, use every avenue of influence we have to try and get a better and fairer funding system in place. Thank you.
Thank you, Stephen. Debbie.
Yeah, it's just listening to everything that's being said, and it's not, a question for one person in particular, just an observation really, is we keep talking about our system and all the good work that we do with often less funding than certainly different areas of the country, if not all. What's our mechanism for feeding up to our central colleagues to say, look what good work we are doing on this budget, and maybe we could free up money if other areas in the country could work as we are doing on our small budgets?
Well, I have
You have a go, Emma. I can say something about it.
I think that's an interesting point, Debbie, and we are part of a programme that does feed in our learning and the work that we are doing to the DFE. I think there are, kind of certainly sort of reflections, and that's one of the conversations we've been having within the council is, kind of what more can we do? How faster can we go? I think a key element of understanding where we were and the progress being made relates to data and understanding at a broader level, and then being able to kind of distill down into individual children and families' experiences what difference is being made, and really knowing what services have the greatest impact. And certainly kind of in some of the findings and the work that we're doing, there are key services that we know make a really significant difference to children, both in the short term and in the longer term. So, for example, provision of speech and language support within early years, and being able to do that. And I think we are in a much better place as part of the work that Jonathan and the team have done in relation to this strategy, of knowing where our gaps are and where we need to strengthen. And what will follow from these strategies is kind of a delivery plan that will support us to do that. But there are real structural inequalities between areas and that we need to address. And I think having a clear indication of sort of data and outcomes data, so that we can share that learning, bring that learning in, tailor services, make our teams work smarter, more effectively. That's all work that we are kind of currently engaged in, but again, there's always more that we can do.
Apologies, I think you're doing amazing work. I suppose my point is, why are we not holding ourselves up saying, look what we've been doing with the budget we have, and maybe saying to central government, maybe you need to look at how well we are doing and using in areas that may have a lot more money but not getting such good return. You know, the whole meeting we're talking about today is we've got to work differently. The money isn't there in real terms. The money is going to reduce in reality. And I think we always do well, which is great for our public in this area. We can always do better. But it sometimes feels that other areas may be getting more of the lion's share for less return. So how can we share our learning so that the public money for the whole of the UK is being used more wisely?
Susan, you want to say something?
Thank you. I think one of the fundamental issues is something that Stephen mentioned, which is the formula that the government actually use, which is based around deprivation in terms of its allocation for funding. So that's how the government allocates. And whilst it's absolutely right to allocate according to deprivation, because that should be absolutely part of the picture. However, at the same time, deprivation, Stephen said, doesn't actually recognise demand that, for example, Wokingham has for adults and children's services. So the government is driven by a particular formula in its allocation. In terms of how well we do for our money, we, through the programme that Emma mentioned, are able to articulate all the different things that are done through funding and through additional funding that we receive from government. But the fundamental issue is that if we talk about SEND in particular, is the high level of demand. And something else that we do is that we raise, again, as Stephen mentioned, we raise the matters with MPs. So we do talk about all the different work that we do and what the things that we think need to be changed. So we certainly seek to lobby about what we do and what could be changed. One example is that Stephen mentioned about the 151 authorities in the country, and there was a recent piece of work done, research done about the productivity of those councils, and those councils, as mentioned, deliver adults and children's services, and Wokingham came fifth, as in fifth most productive out of those 151, and so that in itself demonstrates that was based on spend and the outcomes we achieve. So a lot is achieved for the money that we get. So that's another something else that we can absolutely talk about, and we are articulating. But we do absolutely seek to do that through different channels.
Just a couple of points in response to your very interesting point, Debbie. The first is, of course, there is an inherent danger in demonstrating to government that we're doing incredibly well on very little. The government then says, well, you're managing perfectly well, why do you need any more? So it's one of those messages that we want to convey, but there is a risk in conveying it too effectively. And the second point really comes back to the funding formula. Obviously, reforming any funding formula in a way that we would like, which would be adjusting from a focus that's almost wholly on levels of recorded deprivation, onto something that recognised the true costs of delivering adults and children's services, irrespective of the affluence or lack of affluence of a borough. These services are not means tested, they're statutory, so they fall on all councils, regardless of levels of deprivation. But the problem with trying to persuade governments that we need an adjustment of this formula is that all formulas create winners as well as losers. We're very clearly a loser by this, but there are other councils that are very clearly winners. And those councils you referred to, Debbie, that perhaps get a lot more money than we do, but don't seem to be as productive in the use of it, they're unlikely to be very enthusiastic about a change. And I think that's another challenge we face. It's a kind of political challenge. But we do need to try and keep going on the work of persuading our MPs to lobby for us. I think they're willing to do so. They understand what the consequences are for areas like this. So we will be working very hard with our MPs to try and get the message that all councils need a proper recognition of the true costs of delivering adults and children's services. We've got to, I think, frame this as a problem that doesn't just affect us. And I think if we can do that, we're in a better chance of getting somewhere.
Just to follow up on that, it's quite hard to imagine that you would get much favourable coverage if you were arguing that a more deprived area should get more money, less money than a less deprived area. So I don't think that's a sensible thing to argue. What I do think is a sensible thing to argue is that you can use that formula, but if you go off the scale at the bottom, as far removed from the number 150 as we are to 151, then you ought to have a floor that you cannot go below a certain level, because there is a cost, there is a true cost of delivering services. And if you get nothing like what you need to deliver those services, even in a minimal way, you're not going to be able to deliver them. So by all means, let them stick to having a formula that works mainly on deprivation, but just stop the people right at the bottom falling off the cliff. And I think that is an arguable case, and that you can make the case quite well from that angle, because it becomes obvious that we don't have the money to supply, even if we are one of the most productive councils in the country.
Thank you, Prue. I think that's everyone, but certainly thank you, Jonathan, for presenting these, and for all you and your team's done to produce these, because I hope they're going to be very valuable assets that we can use over the next 5 years and develop our services in the light of them. So thank you very much, and thank you to Emma. Oh, we've got a vote to accept them. Yes, I just forgot. So we've got to, recommendation is that we agree. I'll find it now. But that we accept them. So can we have? I'll pose that for a second. All those in favour? Okay, thank you. Sorry, I'm carried away. Okay, so now we've got the Wokingham Pharmaceutical Needs Assessment with Karen.
Thank you, Chair. Hopefully I won't take much time. So this is just a reminder that the Health and Wellbeing Board has a statutory responsibility to deliver a P&A, a pharmaceutical needs assessment, every 3 years. You recently signed off the process for us developing our P&A with a deadline to publish that pharmaceutical needs assessment by October 25. As part of that process, this includes a 60-day consultation period, and because of the timescales, we're working to a lot of that work. We got delegated to a Bob steering group. Because of that, we're also asking tonight that you approve the that the draft P&A prior to it going out to public consultation gets approved by the steering group rather than it coming back to Health and Wellbeing Board. And obviously being mindful then that they will come back to Health and Wellbeing Board in September for formal sign-off, and obviously you can all act as part of that consultation period. So it's to approve that steering group has that responsibility to approve the draft P&A prior to consultation.
Thank you, Karen.
I don't know what Madeline's looking like. She might know. I sent some photos to Madeline of the opening of the new Winnersh pharmacy. Did you get them? No, I'm not logged into the system, so I can't share it. So the supplementary paper shows that we had a new pharmacy that opened at the end of October. And there are 3 photos, and I'll make sure you get them. They can be included in the minutes. It was a very interesting occasion. It included Indian drummers, the mayor cutting a ribbon, and fireworks, yes, and a huge Indian barbecue afterwards, which was fantastic. So a very popular thing to happen. And as the opening ceremony with a vast cake was going on, people were coming into the pharmacy to get their prescriptions filled and to buy things. So I think it's going to be a good asset for the community, and we're very grateful because we lost our pharmacy out of Sainsbury's some time ago, and have a new one. It's just in the middle of the village opposite Sainsbury's is really excellent. A good thing.
You've beaten me to it, Prue. It was my, as a kind of AOB, the supplementary statement, but as you say, the pharmacy in Winnersh, so it's lovely to hear.
Certainly, talking to him, he's very positive about working with Sainsbury's, doing some work outside Sainsbury's and health checks and so on. And Sainsbury's are quite positive about working with him as well, so that's positive. So, you know, I think it's very good that things are going ahead there, and it's wonderful to have a new pharmacy, especially one where it's needed after one closed across the road. So that's great. We've got to. Is there any other questions or comments? I don't think so. So, as Karen said, we've got to agree about the pre-consultation draft going to Bob, P&A, and note the final P&A report will need signing off by us in September. So I'll propose that, second that, and all those in favour? Okay, thank you very much indeed. So thank you very much, Karen, for getting us through that. And then the last thing is our forward programme. Certainly in January, I think we've got enough with the Berkshire Hospital, the domestic abuse. Is there anything else that we need to think about then?
So just bringing up on the debate earlier. So as part of the ICB update, I'll think about how we incorporate the planning work on that, and perhaps then hopefully confirm that if we get into a formal process in terms of a joint forward plan refresh, how we take that through the relevant bodies for engagement and sign off.
Thank you very much. And then for our March meeting, again, we haven't got that much. I mean, the hospital update. Is there anything else you people feel we need to discuss or plan? Or I'm sure things will arise as they always do. But if there's anything else, do tell either Madeline or me, and we can get these onto the agenda, because it's important to make sure that we know we are covering everything going forward. Okay, thank you all very much indeed for this meeting. I'm afraid it's just over the hour. I'd like to try and get it to an hour, but we had a good discussion about SEND, which I think is something which is certainly very important for both health and for the local council and for the voluntary sector, actually. And it's something that we need to continue to discuss and continue to see moving forward. So thank you all very much for this meeting.